she had
Okay, round 2.
a baby.
Right, which is why we don't give it to women.
Which is why we no longer. Oh, okay, so let's change. Yes, so thank you for that. All right, sorry. Yes, and now you won't forget it.
What's the contraindication for be? Because I thought it was also.
Can I be real and transparent with you? I'm not even sure what a quinolone is.
It's an antibiotic. Oh.
Does anyone know?
No, it's an antibiotic.
With
you.
With it,
Yeah. We feel the same way.
Chances are, if you have no idea what it is, you never heard it in nursing school, it is not the answer.
How about when the question has things you've never
Okay.
heard about?
All right, next. Okay. A 2-year-old with Down syndrome is brought to the clinic for his regular physical exam. The nurse knows which problem is frequently associated with Down. Next. Ricky G, you're going to be on your own. Huh? Ciprozaquinolone.
I just looked it up.
Thank you.
What'd you say?
Cipro.
Okay, Ricky's going to answer this one on his own. When taking the health history of a child, the nurse knows that which finding is an early infection of hypothyroidism in children. Delay in the eruption of permanent teeth, hyperactive behavioral traits, cessation of growth in the child that has been normal, or slow sexual development, but within normal range. I think that you're right. Was everyone else right?
Ladies in waiting.
Way to own it, Ricky. Okay, Steer with an H and Michelle.
Oh.
Which
Mixing it up.
which menu selection by a child with Rachel?
Rachel ate at my apartment live.
By a child with celiac disease indicates that the nurse and the child understands the necessary dietary considerations. Rachel, are you going with C?
Yes.
You are correct.
I know Rachel's dietary habits. That's pretty creepy.
Rachel, you guys, since you're sitting on your own, well, you're not, but they are.
She's
Okay,
back.
you guys lucked out. Jalen and Rachel, the nurse is assessing a 2-year-old. What behavior indicates that the child's language development is within normal limits? Able to name 4 colors, count 5 blocks, half the child's speech is understandable, or is capable of making a 3-word sentence.
You know, I got like a 50 on it. So, language development. Counting 5 blocks is out. Naming 4 colors. Your kid's not all there. I think they should name more than 4 colors.
Well, not a 2-year-old.
I think it's A.
2-year-old doesn't know colors.
I think they can name more than 4 colors though, huh?
No.
No?
2-year-old?
I can name 4 colors.
Maybe no, maybe not a 2-year-old. Okay, I have to like think of everyone in my family who's a 2-year-old, and then I can like apply their knowledge.
They're still waddling around.
Pick one.
They can't
We're
say
going with 3-word
sentences.
sentences just to move on.
They're going with 3-word sentence.
No.
I think so.
Yeah, half of it is understandable.
I think it's colors.
No. It's half of it is understandable.
Oh, dang it. We're all
Okay,
wrong.
see, and that's the reason I didn't pick that. My nurse, my
Wait,
preceptor,
why?
her kid he just turned 2. She's like, I have no idea what he's saying, but the only person who knows is me because I raised him, and nobody else knows what he's saying because it's not
A
understandable.
2-year-old, half of their language is understandable by someone.
Oh.
Wait, but you said that they shouldn't be able to name 4 colors?
A 2-year-old probably not.
Oh,
Probably not that
okay. I
many,
thought you were saying they
right?
could name 4, but not more than 4. That's why I was pushing for that one.
No, they probably can't name
I got
colors at the age
confused.
of
Oh, they were
2.
giving us the answer. Okay.
We have some questions. If you have questions, ask them out.
When is the 3-word sentence?
3-word sentence, closer to 3 or 4. Well,
Oh.
3.
3.
3 and 3. What is like mom?
Okay.
Mental
notes.
I know, but that's
Let's
what I
go
was
back.
going
Oh,
for.
shoot.
That's okay. You can't, because this is HESI.
You can't go back.
This is
The
HESI.
rationale said
18 months. 18 months is when they can start speaking 3 words.
18
Well,
months.
that's about,
so
Oh.
that's more than.
So it's a year.
They can put 3 vowels
So they should be talking more than 3 words.
They can already be in a conversation, yet you can't
I think I just got it.
It's a little weird to me.
I guess the 2-year-olds I talk to or babysit, they are just little chit chatters, so I feel like they are.
2-year-old?
Yeah.
Michelle.
Maybe they're saying
Michelle.
Boys
that
don't talk.
Maybe
Boys
they're
don't
saying
talk.
that is wrong because they would have done that before.
Right.
Oh.
Right.
So it was like,
Person used $200.
Sorry, guys.
because my niece at 2 could speak 4 or 5 words.
Okay, so maybe
But you
that's
didn't
why
always
they're
know
saying
everything
that.
that she was saying.
Right.
Maybe they're
All of
saying,
our 5 words.
yeah, they can do that, but that would have come before
But which
too.
milestone or something is,
Yeah.
can have
Yeah.
understandable sentences.
I don't know, guys. That's all I got.
Keep going.
It is when you're 2.
It is when you're.
Okay, let's keep moving because we are only halfway through the test. We're not gonna get done, but we'll get as much done as we can. A 15-year-old, this is for Emily and Megan. A 15-year-old girl tells a school nurse that all of her friends have started their periods and she feels abnormal because she hasn't. Which response is best for the nurse to provide? Explain that menarche varies and occurs between the ages of 12 and 18. Refer the. Did you just say yes?
Emily did. Do you agree?
Do you guys agree?
Yes to me. Oh.
Okay, next. Areli and Carly, a 6-month-old returns from surgery with elbow restraints in place. What nursing care should be included when caring for any restrained child? Elbows, okay?
Restrain it.
Renew the healthcare provider's prescription for restraints every 72 hours.
No, February 24th.
Remove all restraints simultaneously and provide play activities. Remove restraints one at a time and provide range of motion exercises. Keep restraints on at all times. Everyone agrees?
Yep.
Guys, we're gonna do it single now because it's faster. Okay? So, sorry, Kate. Okay, the mother of a preschool-aged child asks the nurse if it is all right to administer Pepto-Bismol to her son when he has a tummy ache. After reminding the mother to check the label of all over-the-counter drugs for the presence of aspirin, which instructions should the nurse include when replying to this mother's question? Pepto-Bismol may cause a rebound hyperacidity, worsening the tummy ache. Avoid the use of Pepto-Bismol to the age of at least 16 years old. If the child's tongue darkens, discontinue the Pepto-Bismol immediately. Do not give if the child has had chickenpox, flu, or any other virus. You're gonna go with B?
That was like 8. Oh, it's
It's
D.
actually 12, I think.
So what's the answer?
Do not give if the child has chickenpox, the flu, or any other viral illness.
But you're not supposed to give it.
Because the virus gets
Oh,
out?
because of the Reye's syndrome. You'll be more susceptible to the Reye's syndrome if your immune system is already compromised by another virus.
But that just seems like a silly question.
Right,
because
at all.
If he's preschool, we shouldn't even be, like,
Contemplating.
in my mind, I eliminate that because I'm like, oh, he's preschool, don't even tell her anything about giving it to him. 'Cause she
Just tell them to not.
Right.
Right.
I agree. But why would
Throw
you
it
not say Pepto-Bismol may cause rebound hyperacidity, worsening the tummy ache?
It's not
It's clinician Carly,
language.
isn't that what I said?
Yeah.
Right?
Yeah.
But is
That's
it,
too much information.
it's too, like, does she know what hyperacidity? No. The 16 years old, that's not true, I think it's 12. Usually all adult, remember on everything it says adults and children 12 years and up. Kind of thing.
Oh, good call.
If the child darkens, tongue darkens, discontinue it. It's probably, you're gonna wait.
That's bad.
So that's why it's saying that. Pepto-Bismol contains aspirin, there's a potential of Reye's syndrome.
Oh, it contains aspirin. That's why. Makes sense.
That's why. Okay? Sorry, that was tricky. Okay, next. Who's next? Brenna. A 6-month-old boy and his mother are at the healthcare provider's office for a well baby checkup and routine immunizations. The healthcare provider recommends to the mother that the child receive an influenza vaccine. What meds should the nurse plan to administer today? The flu vaccine and the polio vaccine, and schedule another appointment to administer the remaining immunizations. The flu vaccine and schedule another appointment to administer the immunizations. The routine immunizations and schedule another appointment to administer the flu vaccine. Or all the immunizations with the influenza vaccine given at a separate site from any other injection.
This is the thing, right? So they don't get the things. They don't get viruses that are like these, when they're 6 months old, like we said, the MMR is at 12 months old. So we know they're not getting this with that. So at 6 months old, like, I don't know, like, I feel like I know they get like 2 or 3 shots.
What, I think the answer was, isn't it D?
Like, you can get it at the same time.
Yeah, you
just-
give it at
you
the
just
same
can't give
time,
it
but
the
not
same
in the same
place.
shot or mixed in the same syringe. They're not gonna contradict one another.
Dang, that poor.
This wasn't on a kid, but I saw there was, when I was at the hospital one time, there was a nurse and she gave just like an adult 2 shots like in the same arm. And this lady's arm like swole up and it got red. They had infectious disease. They'd like draw an arm around to make sure it wasn't growing and if it was shrinking. And it was a huge hot mess.
Yeah, that would be a huge habit.
So
They
always
all are
in life,
incomplete.
guys,
Yeah,
give
don't
shots.
do this.
So wait, at 6 months of age,
Right.
routine are Hep B, DTaP, and HIB, which is for,
And PCV and
HIB is for what? Again, the
Glottis.
glottitis.
Friday.
And then
After
pneumococcal.
Friday.
Wow, that's
Good
a
to go.
lot. So, but the ones,
It means you would just give the regular immunizations as scheduled and give the flu vaccine, but in a different site from the other sites.
how many
All
shots?
on a different side.
That's
So
like-
how many
what's
times?
that? That's
None
like
of these
6
are
shots.
combo meds, guys.
Oh, okay.
It doesn't mean that they're getting 1, 2, 3, 4, 5,
6.
6, no. The Hep B, DTaP, and HIB a lot of times are a combo drug.
Oh.
I have a question just about immunizations. In a 6-month-old, aren't you pretty much only using the Baxter-Stott or Alex?
Yeah.
So basically, you can go and like you could do like 2 in each thigh. That's about it.
I mean, you can, no, you're really gonna overdo the best you can.
Okay, because I just feel like you wouldn't be poking them more than twice in each leg.
But so some of them are gonna be in the same like site, like not like in the same hole. Right.
Probably. Ouch. But it happens. Okay, who's next? Chenoweth. Chenoweth. A 3-year-old client with sickle cell is admitted to the ED with abdominal pain. That happens, right? The nurse palpates an enlarged liver. An X-ray reveals an enlarged spleen, and the CBC reveals anemia. These findings indicate which type of crisis.
I'm gonna
If
go
you
with
do know.
A.
What is that?
I don't even know
I
what
like
that
D.
is.
Like aplastic anemia?
Sure.
So just
Not
go,
Can
can we
the
click
answer?
next?
That's exactly what I was planning to do.
Oh, what is that?
Sequestration.
Skip.
The
Sequestrian?
findings
Isn't that with
support
horses?
Sequelae. That's the negative sequelae that occurs due to sickle cell.
Thank you, dictionary.com.
That's
I
not
don't
true.
No, sequelae is a.
There's
It doesn't have to do with this. It just looks like it, right?
So you
There are blood
can
pools
do
in
that.
the spleen.
You can
Guys,
say,
we
It's just what it
so
is.
bad.
you can say sequestration is the most serious one. I think. The blood
Yeah.
pools in the
Sequelae usually is
Yeah,
a
that's-
negative term, so.
So that's the one where the blood pools in the spleen is characterized by abdominal pain and dyspnea. The other ones don't create spleen enlargement or abdominal pain. Oh.
Well, they don't have a hyperhemolytic. That does not even occur with sickle cell. And sickle cells aren't,
I think it
Yeah,
does,
they do. It does.
because it breaks them down.
but is it hyper?
Hyper.
Like,
It's it breaks them down quickly. Okay, we're moving on from that, guys. Okay, who's next? Taylor. The nurse is assessing a neurovascular status of a child in Russell's traction. Just say traction. Okay. Which findings should the nurse report to the healthcare provider?
B.
Neuro right there.
That's in blue.
Yeah,
She
Okay,
knows.
who's next?
got that for
Megan.
us. Hot to death.
In developing a teaching plan for a 5-year-old with diabetes, which component of diabetic management should the nurse plan for a child to manage first? 5-year-old,
That's it.
diabetes, you're going to do all of these things, but which one first? Eventually, you're going to do all of these things.
plan for the child to manage.
Would it be D? Food planning? Well,
Yeah,
I mean, which one should I do
I know
first?
your thought process.
Well,
I think your thought process was the same as mine. Was it that it's least invasive?
yeah.
So you're gonna want to teach them that.
I think
So
that would
they're
be
not
less scary
fearful?
to learn my food
Yes.
first instead of
The
poking myself.
problem is they're 5. So what can you teach a 5-year-old about good sugars and bad sugars and starches and protein?
True.
I don't even know it.
The kids.
Right.
My little cousins can rattle that kind of stuff off
Yeah.
at that age.
So you're actually gonna first teach them the process of glucose testing. Because they can do that themselves.
Well, and with the,
You know what I mean? Like, it's hard no matter what.
The kids are going to do the process first, but they probably like couldn't really tell you about the food.
I think the age of 5 is throwing me off.
Yeah, me too.
That's too
They
young.
might be able to tell you guys, they might be able to tell you, okay, I should have brown rice instead of white rice. But they're not gonna be able to tell you the number of carbs in every single, and calculate their plate. Okay, I have 42 grams of carbs on my plate. They can't do that. How much insulin do I do? Okay. Okay, we gotta get as much done as we can. Premature newborn girl, born 24 hours ago, a Bryant, is diagnosed with a patent ductus arteriosus. Okay, do you guys are you familiar with that? Okay, patent ductus arteriosus, and placed under the oxygen hood at 35%. The parents visit the nursery and they want to hold her. What do you tell the parents? Studies have shown that handling a sick newborn is not good for a baby and upsets the parents. You can hold the baby with the oxygen blowing in the baby's face since the level is very close to room air. Since your baby has been doing well under oxygen for 24 hours, I can let you hold the baby without oxygen. The oxygen hood is holding the baby's oxygen level just at the point which is needed. You may stroke her and talk to her.
Confident.
Even if you don't know what a PVA means, can't you rule out 3 of those?
Yeah.
Good.
That's why
So
it's
always, you guys, don't freak out. If there's something on there and you go, oh crap, I don't know what that is. You shouldn't say, oh crap. My boys would be so upset with me.
Don't make me put on my mom
Becca, just so you know, it's 1:47.
I know.
Okay.
I'm waiting until I answer my question.
Oh, okay. Well, anyway, don't freak out if you don't know what it is. Always use your test-taking strategies.
But that's
Okay.
the only one that was about a PDA, public display of affection, and if you wanted to.
Brian, don't make me
I mean,
Okay, Becca, when planning the care for a child who has a cleft lip repair, the nurse knows that crying should be minimalized because it A. Good.
Bam.
That's
a good
one.
You get it,
You got this, girl.
girls.
You're gonna go to
Oh, and Jessa too.
They're gone now.
Okay.
We have to go.
You get it,
Yeah,
Jessica.
I'm gonna come over there and get the clock,
Are you,
okay?
are you looking?
All right.
Or
Lindsay.
you-
Okay, a 6-year-old is admitted to the Peds unit after falling off a bike. Which implementation should the nurse implement to assist the child's adjustment to hospitalization? Use terms such as honey and dear to show a caring attitude. Provide a list of rules that limits visitation of siblings to the hospital. Orient the parents to the hospital unit and refresh memories. Explain hospital schedules to the child, such as meal times.
C or D?
Okay, let's talk that out.
Well, D actually deals with the kid itself.
Right. So C is good because it helps the parents adjust. But the question is asking what's going to help the child adjust. Right?
Yep.
Okay, Queen. The clinic nurse is taking the history for a new 6-month-old client. The mom reports that she took a great deal of aspirin while pregnant. Which assessment finding should the nurse obtain? Which assessment should the nurse obtain? Drainage from the infant's ears, number of ear infections since birth, type of reaction to loud noises, any surgeries on the ear since birth. You agree? Yeah. Yes. Otoxicity diminishes hearing acuity and causes symptoms of, remember, tinnitus, vertigo, in older children. Okay. The nurse is planning the care of a 2-year-old with severe eczema on the face, neck, and scalp from scratching the affected areas. Which nursing intervention is most effective in preventing further excoriation due to pruritus? You're gonna apply soft restraints to the child's wrists, obtain gloves for the child's hands, place elbow restraints on the child's arms, apply finger cuffs on the child's hands.
What are finger cuffs? Elbow restraint.
Oh,
I was.
That's
I'm like finger cuffs. What the heck? I'm glad I can read.
Is it because if they have gloves or finger pads on, they can still rub?
And they take them off. They would take them off.
But what
Have
if
you
you
ever
want a
seen
way
those
to
myths when they
restrain
put people
people?
restraints in?
Yeah.
I know.
I would be
I
very
don't think I
irritated
could
if I
get
came
out
into
of
my
That's
child.
not wrong, folks.
And a 2-year-old.
I think
It's
that
because
HESI is
it's
wrong.
a 2-year-old. I think it's because it's a 2-year-old.
Clearly.
Don't we always
They'll
say the
just take the
restraints
gloves
are
off. Guys, I don't know. It says because it prevents arm flexion and scratching, but it does not inhibit the use of hands for play activities. Well,
It kind of does.
What are they going to do?
okay, A and B can be used.
And Rachel
Yeah,
with the
here's why.
reenactment.
I was right. They can be easily removed by a child and would restrict hand movement. Oh, the cots would restrict hand.
But so if it was an older child, it would be gloves, like a
Oh,
5-year-old?
the soft wrist restraints can be removed, would be able to be removed. But gloves don't restrict hand movement.
Unless it like covers the fingers and you
It's
can
just a
pick up stuff.
calculated loss when you take your exam on that one, guys.
Seriously. All right,
It's a cute-
next, Jeremy. 5-month-old is admitted to the hospital with vomiting and diarrhea. The pediatrician prescribes dextrose 5% and 2.25 normal saline with 2 MEQs of KCl for 100 to be infused at 25 an hour. Oh my gosh. Prior to initiating the infusion, the nurse should obtain which assessment finding? So in other words, you don't necessarily need to get caught up in all those numbers, right? You know that you're going to be giving sugar, saline, potassium. What do you need to obtain first? Frequency of emesis in the last 8 hours, current blood sugar level, appearance of the stool, serum BUN and creatinine.
My gut, I really have no idea. My gut's telling me D.
Okay?
I kind of agree.
D or
Well,
B?
if you're giving dextrose, don't you know what your blood sugar is?
Right.
Yeah.
Yes, but what about this?
I want to see potassium levels on there, but it's not an option.
Right.
Wait. What?
I want to see potassium.
Or
levels.
just serum electrolytes as a whole.
Yes. Remember this though. What do we say you usually have to do before you hang the K?
Look at the picture.
P.
Because, I think Lindsay said
Pee.
because it's so hard on the kidneys
Oh.
that you have to go to urine output to be
Yes.
able to get potassium.
Exactly. It gets metabolized through the kidneys. If your kidneys are already from being dehydrated, you're gonna do more. It's not gonna work. Okay? It's gonna cause damage. It's not gonna. The potassium can become toxic. Okay? That's what I'm going with that. Let's see if I'm right. Yeah. Regardless of a client's age, adequate renal function must be present before adding potassium to the IV.
That would do more damage than dextrose.
When you're in the unit, you'll get a kid for dehydration and you'll hang a bolus, and it'll say give the bolus and then hang D5 normal saline plus K after they void. That's what it'll always say.
Bless you.
Okay? So smart. Who's next? Crystal. Okay, we're gonna just do a couple more. 12-month-old boy is admitted with respiratory infection and possible pneumonia. He's placed in a MIS tent. We did talk about MIS tents because we don't know what these are very much. Which nursing intervention has the greatest priority for this infant? Do you know what a MIS tent is? Pretend you're in a big plastic bag with a bunch of humidifiers. Okay? So have a ball syringe readily available to remove secretions. Give small, frequent feedings of fluids. Accurately chart observations regarding breath sounds, or encourage older siblings to visit. Why? Yes. Did you hear that? Since you're so humidified, your secretions are going to become more, right? They're going to get juicified and start coming out. Do you like that one? G, the nurse receives a lab report stating the child with asthma has a theophylline level of 15. Go on to farm here.
10, 20.
What action will the nurse take?
This was on our farm.
Okay, so let's talk it out. Pass the information on and report. Notify the healthcare provider because the value is high. Repeat the lab study because the value is too high. Hold the next dose.
The normal is 10 to 12.
He's phoning the class.
A.
Why?
Normal.
10 to 20 guys.
The thing about that drug today was, so you give that, and then what signs and symptoms would the person then have? Like,
Adverse, or what's that?
like
If it was high,
a
'cause it was
lot.
like
I remember there were
23.
like two
Yeah, exactly.
options of short of breath and having dyspnea, and I was like, well, that's not good. You know, like that's how it is. So
Okay,
you're giving
we're
it
gonna
to
do
somebody.
2 more. Sarah H. with an H. The nurse is assessing an 8-month-old child who has a medical diagnosis of tetralogy of Fallot. You guys do
They're
the
blue.
Fallot
Is that
sign?
how you say it?
I thought it was phallic,
Blue.
Fallot.
like ferret. Phallic.
Great.
That doesn't even make sense.
Which symptom is the client most likely to exhibit?
A.
That's a
Confident guess.
They have. I thought they have a murmur, but I don't know if it's machine or D.
There's
But they
something that
do
has a lot of
eventually
lines.
have clubbed fingers, and like if they, you know.
Doesn't, what's the one that does have the loud
They're
murmur?
not doing enough. Oh,
So what do we just do this? Does that help you?
Yeah. What? Oh.
Oh.
Why
Hello.
clubbed fingers?
Wow. Because it's a cyanotic heart defect that causes clubbing in the fingers and toes.
Which one has the really loud murmur? Because there is one. Right?
Does that make sense? TED is cyanotic, right? So when you have the prolonged lack of oxygenation, you get the clubbed fingers, right? There was no answer here. When you think TET, you think, okay, I gotta find, it's the blue baby. Whichever one says it's the blue baby. Well, none of this say cyanotic. But what's a result of cyanosis? Clubbed fingers.
In that short amount of time, though, that's why I didn't like it. But don't they
Well,
have
8
a
months. It's his whole life.
I guess.
Bryant?
What does a machinery murmur mean?
Does it mean like harsh?
It means that it sounds kind of like metallic-y, clicky, like a machine is clinking the heart.
Which one? Which defect is that characteristic of? Is there not one?
There probably is.
The right to left.
Maybe I'll have to figure it out.
There is a heart murmur, and it can range from
Yeah. Oh, yeah, there
very
is.
loud, can range almost imperceptible to very loud. Yeah.
It's an obvious murmur if it's there. If you hear it, it's obvious, but it's not the clicky, tangy. You like magic potion?
Yeah.
Okay. Okay, last one, Michelle. 16-year-old brought to the emergency center with a crushed left leg after falling off a horse.
Oh, shoot.
The adolescent's last tetanus toxoid booster was received 8 years ago. What action should the nurse take? Prepare human tetanus immunoglobulin. Delay the tetanus toxoid booster until due. Administer tetanus toxoid booster.
Yes.
Dispense tetanus antitoxin.
Give her that
You're gonna
shot.
do the booster?
Yeah.
Good.
When would you give the immunoglobulin?
When they get bit by a cat? I had a picture. Okay. I had a patient.
Michelle, what?
Okay, so I had a patient who got bit by a cat. She's trying to rescue it. And
You
it bit
did
him.
tell me about
And it
this.
ran away. So we didn't know if it was rabies or not. So we had to give him the booster in his arm, and then we had to give him 13 milliliters of immunoglobulin in his hand.
So they give the immunoglobulin if they,
Of rabies?
if they think
Yeah.
that they have
No,
exposure.
they did tetanus.
I
with it.
guess. I don't know.
Wait, they give it to you? I thought we shot them in the stomach.
Like, is that, what do you mean in a hand?
Well, the bite was in
That's
the
where he got
hand.
bit. So they wanted to infiltrate the area where he got
So
bit.
usually
like a little
you give it every 10 years unless there's an obvious injury that
Go
could result in it.
It's like intradermal. And we did it all the way up
So
to
why
up to like here.
wouldn't you give the immunoglobulin in this instance?
Because they weren't specifically exposed to it.
I've always wondered what happens, because when people come into the ER with dog bites, it's so imperative that we get those dogs' records, and I've never followed up to know what they have to do to them once they come up to
The
the
dog
floor.
gets quarantined. They
Probably
don't
shot.
unless it's for 10 days.
Yeah.
And then, yeah, then the
No,
propulsion gets treated for
No, Mom.
rabies.
Right.
Sarah, my sister got to put a cow down the other day. She
Yeah.
killed the cow.
Yeah.
How'd you kill it?
Well, it was, we don't have lots of medicine, and so she injected it with like solution. But
All right,
then
guys,
it's also
we only got
put
through
its head, and
53.
it still
There's
wasn't
89
dead. So
questions.
she had to give another injection
So
of
I
it.
changed the settings. Have any of you gone
Good
on?
story lines. What's that? Bye, Allison.
Good. You have carbs, exactly. So it's fine.